Deep vein thrombosis. What is deep vein thrombosis? It is also called as DVT. I am Dr. Nadeem Sajjad Raja. Deep vein thrombosis, DVT, occurs when a blood clot, thrombus, forms in one or more of the deep veins in the body, usually in the legs. Deep vein thrombosis can cause leg pain or swelling. Sometimes there are no noticeable signs and symptoms. You can get deep vein thrombosis or DVT if you have certain medical conditions that affect how the blood clots. A blood clot in the legs can also develop if you do not move for a long time. For example, you might not move a lot when traveling a long distance or when you are on the bed rest due to surgery, an illness, or an accident. Deep vein thrombosis can be serious because blood clots in the vein can break loose. The clots can then travel through the bloodstream and get stuck in the lungs, blocking blood flow. That is also called as pulmonary embolism. Deep vein thrombosis symptoms can include leg swelling, leg pain, cramping or soreness that often starts in the calf, changes in the skin color on the leg, such as red or purple, depending on the color of your skin, a feeling of warmth on the affected leg. DVT can occur without noticeable symptoms, as I mentioned earlier. When to see your healthcare provider or doctor. Contact your doctor as soon as you experience any of DVT signs and symptoms. Anything that prevents the blood from flowing to properly clotting can cause a blood clot. The main causes of deep vein thrombosis are damage to a vein from surgery or inflammation, and damage due to infection or injury. So what are the risk factors? Age. Being older than 60 increases the risk of DVT, but DVT can occur at any age. Lack of movement. When the legs do not move for a long period of time, the calf muscles do not contract. So muscle contractions help blood flow. Sitting for a longer time, such as when you are driving or flying, increases the risk of DVT. So does long-term bed rest, which may result from a lengthy hospital stay or a medical condition such as paralysis, injury, or surgery, pregnancy, oral contraceptive pills, being overweight or obese, smoking, cancer, heart failure, inflammatory bowel disease. So how we can diagnose DVT? So diagnosis of DVT depends on the imaging results and clinical suspicion of this disease. So different techniques are used: duplex ultrasonography, D-dimer blood test, contrast venography, magnetic resonance imaging. So how we can prevent DVT? Move our legs regularly, stop smoking, reduce weight. So what is the treatment? Medication is used to prevent and treat DVT. Compression stockings, also called graduated compression stockings, are sometimes recommended to prevent DVT and relieve pain and swelling. These might need to both work for 2 years or more after having DVT. In severe cases, the clot might need to be removed surgically. Thank you very much for watching this video.